Federal cuts continue to impact states and counties, including ours. Monroe County just learned of a cut that will impact some employees at the health department. Here's News 10 NBC investigative reporter Jennifer Lukey.
4 positions here at the Monroe County Health Department are or were funded with federal dollars, money that is no longer coming here to pay those salaries.
We were just notified last week about a healthcare fellowship program that was cut, eliminated by the Department of Health and Human Services that funds 4 positions in the health department.
2 of the fellows were focused on emergency preparedness for climate events and illnesses associated with climate changes. One was managing the county's transition to a new early intervention system, and the other was working to embed trauma-informed practices into the department. The state health department placed these fellows in Monroe County and paid them through a federal grant, but that has now been cut.
And they were supposed to be funded through July of 2026, but we were recently notified that their last day would be May 30th.
The commissioner says it'll be a real loss.
So they were doing really important work that we had either not been able to start or were just working on very slowly because we did not have the staff bandwidth to work on these really important topics.
And they don't have the money now to keep them on. The commissioner says this is only a small part of the $300 million in federal cuts impacting the New York State Department of Health that's trickling down to counties and nonprofits.
These are programs that cover childhood lead poisoning prevention programs. We're talking about the National Asthma Control Program, Environmental Public Health Tracking Networks. These are key federal programs that try to avoid preventable deaths from environmental hazards.
The county executive is also worried about what further cuts could be coming and where.
But there's no special funding stream if hundreds of millions of dollars of Medicaid and child care and all those dollars and SNAP benefits just disappears.
The county executive tells me he's having weekly meetings with department heads, state representatives, congressional leaders in order to try and have an understanding of what other cuts may be coming this way and when. In Rochester, Jennifer Lukey, News 10 NBC.
The Department of Health and Human Services has already been downsized by about a quarter of its workforce. CDC staff were among those laid off.